Coming up on Health Matters, we'll visit the Metabolix Wellness Center and talk about chronic disease with Dr. Reagan. Sit down with Dr. Timon and learn more about body sculpting through liposuction. And it's allergy season. Don't miss our report with an allergy specialist from Florida Medical Clinic. Find out about the newly discovered risk of the morning after pill. All this and more coming up on Health Matters. Doctor, what is the definition of a chronic disease?
Chronic disease is a chronic or persistent illness that is very difficult to treat or manage, and some people don't even believe that you can really cure chronic diseases. But by definition, it's an illness or condition that lasts over 3 months.
What are some examples of a chronic disease?
There's a whole list of chronic conditions or chronic diseases, and that includes cardiovascular disease, cancer, diabetes, epilepsy, Alzheimer's, any systemic or connective tissue disorders like lupus, ulcerative colitis, Crohn's disease. They even have some of the psychiatric illnesses in there, such as bipolar and depression. But you know, the list is very long.
So then you're saying this affects a very large part of society?
Oh, a major part.
Okay.
Yeah, it's pretty much it's like one of the leading causes of death and disability in the United States. You know, about 150 million adult Americans are affected by at least one chronic disease. That's about 50% of the adult population. And 80% of people over the age of 65 have at least one chronic condition. And what's interesting is the Center for Disease Control is now showing that about 1 in 10 children have a chronic condition, which is it's much higher than back in the 60s. So that's the most alarming thing, is that now our children are actually being affected by chronic conditions, when back in the 60s it was very rare.
Doctor, is it possible to maybe prevent a chronic disease?
Preventing's easy. When they talk about cure, it gets a little bit more difficult. But chronic disease or chronic conditions are still caused by the most preventable health risks. And number one is smoking. Number two is obesity or being overweight, which is soon to be overtaking smoking as the number one. And it's probably almost equal now. And then inactivity. So you take those three, those are still the top, preventable health risks and are by far the leading causes of chronic disease. Then you throw in other factors such as environmental exposures, genetics, and other items, but it's still the common preventable health risks that we kind of all know are there, are still the leading causes of chronic disease. As far as cures, I think cures are going to be coming much more commonly in the future, but I do believe that you can manage chronic disease so much to where it is so controlled that you really have to consider that it is cured. But I mentioned, when you have smoking, obesity, and inactivity as the three leading causes of chronic disease, there's your prevention.
Are chronic diseases a costly health problem?
Yeah, it's about 75% of our healthcare costs is dealing with chronic disease. And as you saw, 50%, 1 in 2 adult Americans have some form of chronic disease. So managing that is where most of our healthcare costs go. And one of the couple of diseases that are on the rise, both in children and adults, is diabetes and obesity. And now these are starting to really start accruing most of the healthcare dollars. And when you think of those, and even obesity as a chronic disease, you can see how it easily can start adding up the healthcare dollars.
Talk about your seminars that educate people.
We really like to center most of our seminars based on what you can do to prevent and manage and cure disease. Education is great, but actually actions is where you really get your results. And so we educate, but we like to give more information about what you can do. We focus our seminars on really trying to give answers and the ability to put people in the position to create an action and then results.
Talk about your treatments. What is your office doing to prevent chronic diseases?
Well, sometimes I feel like I just become a motivational speaker because, it's very hard to get people to change behaviors. So our treatments are really using the highest end diagnostic testings, micronutrient testing, looking at things that the average doctor's office don't look at to find more opportunities and more solutions for patients to kind of get a handle or prevent chronic disease. We also then, kind of use subjective information, finding out what the patient's complaints are, and then use that to kind of create a plan, put that plan into action, and then the real big part of our treatment is making sure that the action plan is actually carried out. That's where the results are found, and that's the most important part of our treatment plan is different diagnostic procedures, and then obviously putting this into an individualized plan and then getting results and really making people accountable for their treatment plan just as much as we are accountable to manage it.
So tell us a little more about telomere testing.
Telomere testing is very interesting. It actually won a Nobel Prize, and it's basically taking a look at what your cellular health, your cellular age is, and compares that to actually your chronological age. And what that tells us, especially someone with chronic diseases, or someone that's just trying to prevent chronic disease, that gives us an indicator of how you're doing internally. Sometimes people can look great externally, but inside we find that they're aging a lot faster than their actual chronological age. And a lot of times it is due to nutritional deficiencies and the way people eat, and it's only a matter of time before they start to feel the effects. And adult Americans do most of their aging between the ages of 40 and 50. And so getting this information can really put some diagnostic data right in front of someone and say, look, you might be 45 years of age, but cellularly you're 55 years of age. And by doing that, we can really lay the foundation to get someone a little bit more motivated to actually do something a little bit more progressive about their health. And by finding that information, we can then use that to say, hey, look, if you keep going at this rate, you're probably going to end up with a chronic disease, or if you already have one, you're going to be starting to work on your second or third.
It has helped my condition in living a better life and living longer and healthier and happier, certainly. And I actually went 2 months without I come in here just to see if I felt different, and it was a big difference. Yeah, it was incredible. I mean, Doc takes it to another level. He takes it to it's more personalized, and his staff here is incredible. I mean, the people here are just it's like family. They make you feel like family.